Hey guys, hope you're doing well. I'm just trying to start a little early today just because I do have a couple things I need to get to. I do have a patient that I need to see as well, so I wanted to start this discussion mainly to kind of tie into the inflammation Periscope that I just had last Wednesday. Basically, when it comes to inflammation, I did point out some of the top 8 things I think cause inflammation for us with the foods that we eat, but more importantly, how inflammation ties into hormones. So a lot of people really don't understand hormones, and I think the most basic thing to start off with is understanding exactly what a hormone is and what it does in your body, and some of the things that can cause symptoms of deficiency or symptoms of excess if your hormones get out of balance. A lot of the things that we know about hormones is that they are affected by a lot of other things. For example, they're affected by the vitamins that we get from the nutrients that we eat. They're also affected by the supplements that we take. They're affected mainly by stress, by that inflammation that I mentioned in the previous Periscope. So there's a lot of things that doctors need to address that relate to hormonal imbalance. And if you don't have a physician that's capable of doing that for you, please come see myself, see somebody else that is, well-versed and well-educated in hormones, because they're very, very important for the balance purposes. The best thing I can tell you about my experience with hormones is that I do know firsthand what it's like when there is a hormone imbalance. I did know what it was like to have a lot of that inflammation, and that was a huge part of my own wanting to research and educate myself on hormones. The most important ones that we think about when we think about hormones for men and women, we do think of testosterone and the estrogen, progesterone we often think about for women, also balances with FSH and LH. We think about our thyroid, we think about cortisol. Lately, we've also been thinking about DHEA. Those are some of the main ones that we often think about when we think of hormones. However, there's many, I would say hundreds of chemical messengers that are going on throughout our body. Those are just the most important chemical messengers that we think of when it comes to symptoms of deficiency and excess. To define a hormone in particular, the most basic way I can define it as just a chemical messenger. So hormones are chemical messengers that are basically made in one part of your body, and they travel through other parts of your body, through your bloodstream or even through the tissues, to control how those cells and the organs work. Sometimes hormones even make effect on just the tissues within themselves and not necessarily in one of the organs. And they do come from specific areas in particular, notably the endocrine glands. The things we think of are like the thyroid, the adrenal glands, your testes and ovaries. Those are some ones that we often think about. But there are different types of other hormones and things that are affected through the diet and so forth, going on all throughout the body. Hormone imbalance for men and women, sometimes you don't realize that some of the symptoms that you have could definitely be hormonal. For example, agitation, irritability, frequent weight gain, inability to even lose weight, even though you have, quote, been doing everything that you're supposed to be doing, and you really try to, but then, you're not able to budge on the scale. So some things to address there. I also can think of low libido, very low energy in the mornings, low energy throughout the day, people having irritability and wired sleep issues at night. So all of these things, they do play a part with hormonal balance. And of course, the hormones, they're also affected by vitamins. They're affected by the nutrients from the foods that we get. They're affected by the way you manage inflammation in your body, whether it's through exercise, meditation, keeping an eye on your diet so you don't take those inflammatory foods and so forth. So there really is a balance there. To me, I personally think of hormones almost like a symphony. Each different hormone that I think of, like whether it's the testosterone, the estrogen, progesterone, the thyroid, all of those things need to be in balance. And when they are, each of them to me represents an instrument. So when you actually do get all of the hormones in balance, it does play out a symphony. It does play out to the body to feel the best, for women to feel optimal, for men to feel their best when they actually have optimal levels of hormones. I think that the most important thing that you can do is recognize whether you have some of those symptoms, even bloating, irritability, like I had mentioned, weakness, brain fog, short memory loss, memory lapse issues, things that you notice really with the weight, even weight loss, even constant weight loss. palpitations, all of these things. I'm sure some of you have experienced firsthand the way that I have. So definitely seek out a physician that you can trust, that basically knows a lot more about hormones. Talk to them about whether or not you may even think that there could be a hormonal imbalance. You can come to EliteHealth. We definitely do a lot of hormonal balancing and talking to patients and educating about hormones, especially when it comes to your own personal symptoms and things that you know or you even are aware of that could be causing hormone symptoms. And also we talk about diet and how important that is too. I'll show you an example here. This is an example that I got from a company called SpectraCell. And basically what they like to do is they do show symptoms of excess and symptoms of deficiency and the types of things that you would expect when you have those types of symptoms. Also on the left it shows severe nutrients, key nutrients. The key nutrients, like I mentioned, you'll get from the foods that you eat, also from supplements that you take, and how well you're keeping up on that end. So this is just an example. If you guys want a copy of this or you want something like it, feel free, you can email me. My email address is Jacqueline Tolentino, so it's jt@elitehealth.com, and I'd be more than happy to share this with you, along with the anti-inflammatory pages that I had from the last Periscope. So again, if you have any issues or you're thinking and concerned about hormonal imbalance, make sure that you seek out a doctor that is well versed in hormones, that understands the connections between that and the rest of your body. Feel free to come see me at the office. I can even send this information via email so that you can educate and learn more about the different types of hormones. And I will see you next week. We will touch base more in detail about some of the more common ones that I do get a lot of questions on. For example, testosterone. That's a huge one I get questions on for both men and women. And yes, for the women, it's not just men only that need testosterone. Women make it, women also need it. There's a lot to go along with that one. So over the next couple of Periscopes, we'll be talking about the different types. I'm going to focus on testosterone for the next one and answer some of the most common questions that I get in the office from from guys of all ages, from women of all ages regarding testosterone. And I will see you next week. Take care.